All right, this is all very well, but I want to talk and bring us back to the real question here. We've got a bunch of pain specialists, and it's all very technical, but let's talk about non-pain specialists again. Do they really understand the effects of PHN on peripheral and on the central nervous system? And do they understand how this all of this can impact on the efficacy of various treatment options, Joe?
Well, you know, Peter, that's a good question. I think we all still are learning more and more about peripheral and central sensitization and how this works in maladaptive chronic pain syndromes. We know that with central neuronal plasticity, there are going to be changes in the patient's anatomy and how they're going to be able to perceive pain and the consequences of that. So I think that it does come down to an educational deficit that we have. If you look at a lot of the medical school curriculum that we go through during the 4 years, only a very small amount of it is really dedicated to pain medicine, and yet pain is the #1 reason why people seek medical care. I think Christopher and Jeff can tell you a little on their input on that, but I think they would agree.
I'll just chime in and say, Joe talks about peripheral and central sensitization, and what better disorder than PHN to discuss with the primary care physicians? Something that they know happens at the level of the spinal cord, the dorsal root ganglion, but yet has its manifestations out on the skin. So I think they understand this model of something's happening in the periphery, something's happening in the CNS, and that's a great educational tool to use to say, hey, maybe we'll use a topical analgesic preparation, like maybe a lidocaine patch or a topical anti-inflammatory. But we also need to use some neuropathic compounds and maybe even opioids for the central effect. And that's really where that peripheral-central marriage comes along.
And you know, we've all been talking about pain as if it's unidimensional. It hurts, we got to make the hurt go away. But PHN is more than pain, right? There are lots of other complications associated with the syndrome which affect patients' quality of life. Like what?
Yeah, I mean, for instance, one of the classic symptoms of PHN is what we call allodynia, or sensitivity to light touch. These patients can't tolerate the bed sheets. They don't wear clothes. They can't tolerate the fan or the air condition, so their quality of lives are miserable. You
know, the closest I can come to that in acute pain is gout. They always talk about, I can't tolerate the bed sheets on my feet. And this is something that's not self-limited, doesn't go away with, with a specific gout therapy. This is for a long, long period of time.
I also think many of these patients suffer in silence. I think they're in severe pain. There's significant peripheral nerve damage and central nerve damage, as Jeff stated. But what I find is that due to their age, they tend to underexpress their pain to me.
Which is important, because I've got to tell you, correct me if I'm wrong, what I hear from docs who, as a group, are frustrated by pain patients is, oh my goodness, they all complain. They're always in my office. They're always complaining to me about their pain, and you're telling me they're not, they're underreporting.
Well, what you're saying may be a subset, but it certainly doesn't apply to PHN patients, in my experience.
My guess is it doesn't apply to any of these patients. What do you think?
I think that with older patients, because of temporal summation, they actually feel pain worse and for longer than a younger patient. And I think it's not uncommon that we do adopt the process of start low and go slow. During that period of time, they're in a lot of pain. And so it may be part of this philosophy that as you get older, you have to live with more pain. I think Chris is absolutely right, though. These patients suffer in silence, and it can have physiological changes too. You know, if your patient's not able to have good respiratory exchange because they can't expand their lungs because they don't want to breathe because it's that painful, it could be problematic.
All right, let's